or phosphorus, and phosphorus has been demonstrated to reduce symptoms of uremia. And it's also believed that it benefits glucose tolerance, metabolic acidosis, and secondary hyperparathyroidism. So you improve all of these complications of patients. And of course, it slows down the progression of chronic kidney disease to chronic renal failure. So we reduce or we prevent deterioration of kidney function by limiting protein requirement in these patients. And this is basically how happens abnormalities in protein and anti-metabolism in uremia. You get a lot of complications, like for example acidosis. You increase your branched chain amino acid oxidation, you increase protein degradation, thus you decrease your protein and amino acid catabolism and increase your requirements. So in uremia, you basically increase your nitrogen requirements, and this nitrogen is the one that is causing your toxicity in uremia. Let us go back to the requirement again. In patients with chronic kidney disease, we have this conventional low-protein diet providing 0.6 grams per kilo per day. And sometimes we use very low-protein diet with 0.3 as the computed grams of protein per kilogram per day. And the energy requirement is from 32 to 37 kilocalories. Kilocalories per kilogram per day, and it varies somewhat per individual. What is conventional low-protein diet? Patients maintain neutral BMs the study showed that when using your low-protein diet, you maintain your neutral basal nitrogen requirement. It diminishes your uremic symptoms, and also it prevents adaptation to the problems of protein in patients with who are non-acidotic. And then this is the basis for this particular recommendation, a review of 13 RCTs or randomized controlled trials, and it shows that it is better among diabetics compared to non-diabetics, and it trends towards greater effect with each additional year of follow-up. And in terms of decline of your GFR, 0.53 ml per minute per year reduction in your GFR. What about your very low protein diet plus supplements? Again, it gives you neutral basal nitrogen or neutral nitrogen excretion, and there is no change in your weight and serum proteins when assessed. And of course, you conserve your nitrogen. Keto analogs are the ones that are being used for supplements in very low protein diets. It is a deaminated amino acid. It does not contain nitrogen. They do not generate nitrogenous byproducts and are acceptors of amino acids. So most of you are familiar with keto analogs because most of us are prescribing it, and this is the brand that is being used here in the Philippines, ketosteril. These are the components of your ketosteril. As you can see, these are analogs of your amino acids. They do not produce nitrogen. Okay? And amino acids are also part of the composition of your ketosteril. It gives us a total of 6 grams of protein per 100 milligrams. And of course, most of them are calcium based. It also gives us calcium 8.3 per 100 milligrams of the tablet. Ang problem lang is the tablets may be very expensive. So how do we assess adequacy of our treatment? Of course, we have to estimate our urinary urea nitrogen. We have to estimate body weight and blood urea, and then we compute for the nitrogen requirement based on this formula. If the estimated and prescribed protein differ by more than 25%, the patient is referred for dietary review. Of course, we may need to ask patients what their meal has been for the past 3-4 days so that we can have diaries or recall. But in terms of laboratory, we can get serum albumin transferring and measurements of the anthropometrics, yung mga thigh at saka arm, forearm measurements. What about patients who are undialyzed? What recommendations do we give them? Mga stage 4, stage 5 patients na hindi pa na-dialysis. Of course, we know that high-protein diets can cause uremic symptoms, and we have to restrict dietary protein. It increases the risk of muscle wasting, nevertheless, and loss of lean body mass. So we have also to monitor how much protein are we restricting these patients to prevent muscle wasting and loss of lean body mass. We have to have objective criteria. One of them would be serum proteins, as I said, anthropometric examinations, plasma amino acids if it's available, and other measurements of protein metabolism. These are the diets that has been proposed for our patients. This is an example of a recipe that helps us to determine how much protein we are giving these patients and how much calories we are giving these patients. So this is in fact chicken. So some patients will ask us if they can eat chicken or they can eat meat, pork or beef. Kasi nagkaroon failure sila. But because we can still give them portions of chicken. This is just an example of chicken breast, even shrimps. Okay. These are the calories from that particular recipe. Calories is 122 calories. Protein is 11 grams. So 11 grams is still within the requirement. It's 0.6 grams per kilo per day yung requirement. So if you are 50 kilogram individual, that would be about 0.6 times 50, that's about 15. So pwede pa rin yung requirement mo. Kasi per serving yun, ang computation.